Now I'm going to say two words that are probably going to make your heart rate go up, they're going to make you sweat, they're going to make you feel fearful and a little bit anxious. Root canal. There, see? Ah! I've terrified you because those words, root canal, oh my God, I said it again. I'm so sorry if you're of a nervous disposition. Root canals strike fear into people because there are so many horror stories about them. And people have heard also that they're bad for you and that you should never get a root canal. Well, I'm here to tell you that that is not always the case. That not all root canals are bad. And I'm going to tell you why. I see lots of patients who don't want a root canal. And that's because many of them are simply scared and they've heard horror stories about, oh, having a root canal is really bad, it's painful and it hurts. And I guess you've heard the same. Well, firstly, that's not true because just like getting a filling, we numb up your mouth and after that we can work on your tooth and do the root canal treatment without any pain or discomfort. The problem is that by the time a tooth needs a root canal, it's often infected and quite sore, and you're in a lot of pain when you come to see us. And that's why people freak out about needing to have a root canal, not actually getting one. Now, some of those people who say, I'm never having a root canal and I'd rather just have my tooth out, they think this way because they've heard having a root canal is bad, that it's bad for you and it's bad for your health. Now, is that true or is it not? Well, I will answer that, but first of all, if it's not black or white, then why is it that so many holistic dentists think you should never have a root canal, and if you have one, you should have your tooth taken out? Well, I don't quite think that this is always the case. So I'm going to encourage you to stay and listen to why before you make up your mind about a root canal and whether you should opt to have an extraction and an implant, which again, I don't always think is the best thing to do, and I will tell you why later. You might now be wondering why then. It can be both a bad thing and a good thing to have a root canal, and if, like other holistic dentists, I advocate against it and taking teeth out or not, and then if I don't, why? Oh, that was a long-winded way of saying, is it good or bad, Rachel? And if you think they're not bad, why do you think you're not bad? Well, why is it holistic dentists say all root canals are bad and all root canal teeth should come out? Well, that's because there's information about root canals harbouring infection and being a source of infection elsewhere in the body. Well, that's not been fully proven. And because techniques and materials and our ability to control and alter bacterial populations has changed in recent times, I'd say that information's no longer accurate. Now, there's a lot of stuff out there in internet land about how bad root canals are and saying they're killing us and they're making us sick. And I've done a lot of research on this for you so you don't have to. And I've done videos on it and I will link those for you, so please go check them out. Now, by using the right techniques and materials, we can make the tooth and the root canal and the root environment very alkaline, which means bacteria don't grow easily in that level of pH. They like acidic, not alkaline. We can also use 3D x-rays and viewing microscopes that help us locate the canals in the tooth. We use rotary instruments and cleaning files to clean out and shape the root canals, along with a bioactive sealant that suppresses bacteria. The problem with older techniques was that many canals were missed during the clean-out phase. As one, we couldn't find them and access them properly, and two, we were trained that some teeth only had 2 canals when, example, they had 3, or 3 canals when they had 4. And that meant that we would locate and treat what we was told was the right amount of canals, not knowing that we'd miss one, which means that it had been left uncleaned and untreated, and that leads to ongoing infection and problems with the tooth. It's not like that now. You may have heard about the Western Price studies, the Price-Pottinger studies, and those of Hal Hoggins. All of the data that they used that said root canal were bad and toxic was referring to this old root canal technique where canals got missed, uncleaned, toxic materials were used to clean, disinfect and fill the tooth. The problem here is that data is outdated and it's no longer applicable, and thus can we still rely on what their studies found and still have that hold true today? Disclaimer, I do still have concerns though, as some older dentists, not the root canal specialists, still use that old technique, and that is how they've been trained. They haven't kept their skills up to date, and that approach is out of date. So they use hand instruments instead of the rotary ones, bleach to soak and clean the tooth instead of the alkaline bactericidal ones, and then they use non-compatible fillers when they fill it. Now, I don't want you freaking out. I don't want you panicking if you had a root canal done this way or one that was done many years ago, because it doesn't necessarily mean that your tooth is unhealthy or going to make you sick. If that tooth has no symptoms and it looks okay on a 3D X-ray, then we would advise that your body has it under control and you should leave that tooth alone. Now, standard X-rays don't show infections well enough, and you need to get a 3D cone beam to know for sure. Now, there's been advances that can be used during holistic root canal treatment, and that is the use of laser and ozone instead of just bleach to properly clean the tooth, ozonated flushers and bactericidals, and this all reaches the super fine extra side canals and accessory canals that we actually can't reach mechanically. The biologically active medications also help to do the same thing. So we can thoroughly and properly clean the tooth, which we couldn't do in the past. We also use biocompatible fillers so that this maintains the health of the periodontal ligament, which is the protective membrane or sleeve that sits around the tooth, which is part of the blood supply to the tooth, and it protects against bacteria getting down between the gum and the bone and the root of the tooth. Now, a lot of the new research out there supports this advanced technique, and how incredible is it that we can be healing your teeth versus having all your root canal teeth extracted, or also having teeth unnecessarily treated that might not have needed it in the first place. Now, you may think or have been told by your dentist that it's just better to get the tooth out and be done with, and I'd say, I don't agree. I don't agree with that, and this is why. When you have a tooth out, the periodontal ligament is removed, which means there is no protective barrier. There's nothing between your gum and the bone or the implant, and this makes it prone to long-standing chronic infection and inflammation, which is what the whole point of having a root canal in the first place is aiming to avoid. Also, the ongoing maintenance of an implant is a lot more difficult than it is taking care of your own tooth, and this is another reason I advocate keeping your tooth where it is possible. And look, if after listening to this you still don't want to have a root canal, that's fine, but at least make sure you have both sides of the story and check out and watch this video.